Hi, this is Rachel Eno, and this is my presentation on the clinical auditing model. Within healthcare, there exist quality improvement methods to help guide research and development. The method I have chosen to research is clinical audit tools. Clinical audits refers to procedures which are aimed at ensuring activities are carried out for the purpose that is consistent and effective in achieving set objectives. Clinical audits are an important part in the continuous cycle of quality improvement, focusing on specific issues of healthcare and clinical practice. They are a way of measuring an outcome or process against a set of standards, which is backed by evidence-based research within the healthcare system. The goal of audits is to locate and understand the discrepancies that can exist between the actual practice and the standards. The clinical audit cycle is composed of 5 stages, which is constructed to improve patient care and uphold the set standards that they already have in place. The final aim of the cycle should always be to improve patient care within the healthcare system. The first stage of the cycle is planning for the audit. In this stage, the stakeholders are identified. Stakeholders are anyone who is involved with providing or receiving care. All stakeholders are relevant to the improvement concept and should be given the opportunity to contribute. It is with this type of teamwork that improvement happens and continues to occur within the setting. Next is to determine the topic. The topic should be something that's of greatest potential, has the greatest potential for improvement, something that could be that's at high risk, that could be like potential to the harm of the patient, something that has to do with high volume, like frequent procedures, or something that is high cost, because with the healthcare industry, you all know that we are always looking at working on the budget. The next thing is the delivery system. The delivery method. This is how we best reach the sample population. Should be user-friendly and easy to understand. These are things that can be like a checklist or a questionnaire. The second stage of the cycle deals with the selection of the audit topic. This requires careful thought and planning, as well as reviewing the resources that are available. Due to the high possibility of limited resources, it's important for the team to prioritize audits. The main objective of the team should be the quality and safety of care, which should guide the selection of the audit subject. The focus of the subject should be where the greatest need for quality improvement lies. The team needs to ensure that the audit sample size is an actual representation of the target population. It's important that the audit be utilized to collect data which fits the purpose of the objective, as seen with inclusion and exclusion data. Inclusion data is defined as a target population with whom the improvement to practice is affecting. Exclusion data is defined as the population outside of that area. Measuring performance is the third cycle, which consists of 4 parts. The first part is data collection. This deals with the collection of the data about current practices in order to provide a comparison throughout the process. Data analysis consists of converting the data into useful information. Drawing conclusions is the part of the phase in which you identify the reason why the standards were not being met. And then, of course, you present the results. This is the part of the phase in which you present your findings, generating interest and discussion, which will further foster and support the plan, which keeps it on track to be a continuous cycle. Making improvements. This is the 4th stage, and it is the stage in which the team develops the improvement plan. The purpose of the clinical audit is to assess if clinical standards in practice are in fact meeting their objectives. If the results show that there is room for improvement, a plan can be implemented to assist in meeting the standards. There should be in-depth discussion within the team to ensure correct interpretations of findings in order to clarify that action is required to improve the quality of care. The fifth and final stage is sustaining improvements. The audit cycle is a continuous process. With any type of improvement plan, there should be continuous monitoring to ensure that standards are being met. The process should also be continuously reviewed, which is the role of the committee. The progress should be performed at regular intervals, and appropriate action should be taken to ensure that progress is being maintained. Within both the committee and healthcare unit, it is important to celebrate success with the plan. This continues to help foster change, foster improvement, and continue to keep that drive to initiate change within the team and the staff. Now we'll discuss some advantages of the clinical audit method. It is a straightforward method which can be used in any setting within the healthcare system. The clinical audit cycle is easy to understand. Each phase of the cycle is well-defined and has clear components. The clinical audit method serves as a way to assess current standard sets that are in use and that we use every day. And this can lead to more education and more training opportunities for staff. Clinical audits are also a way to determine if there is a need for improvement and to make those improvements. Lastly, it embraces teamwork within the unit, driving the improvement, and it can ultimately facilitate unity within the unit. Some limitations with the clinical audit method. Within each phase of the cycle, there are various components, which this can cause overlap, making some analysis difficult. The whole process can be time-consuming, so the team and the stakeholders must be committed to the objective, to the entirety of the process. And the cycle does deal with a large amount of information, which has the capability of becoming overwhelming. Within the primary care setting, the clinical auditing tool acts as an effective tool for identifying areas of improvement, driving and implementing change. It can change practices to improve the quality of care. The clinical audit tool is a systematic review, meaning that it allows all stakeholders involved in the patient's care to participate and to make changes. This team approach gives the stakeholders a sense of ownership and commitment. Another effect that the clinical audit tool has in primary care is identifying the need for education and training opportunities. Next, I'll just give some examples of some case studies and how the clinical audit tool was utilized by advanced practitioners. The first was an audit of the management for obese patients. This clinical audit was conducted by team members within a primary care practice. The advanced practitioners noted an increase of overweight and obese patients within their practice who did not have proper care plans addressed. Data for the study was collected over a year. The standard set addressed was that all health records for adults with BMIs over 30 kilograms would contain a multi-component weight management plan. The audit found that 8 out of 72 patients within the study had weight management plans in their record. The results were reviewed during a committee meeting, and it was found that in discussion that the hard copies for the paper record were less important than documentation in the actual electronic record. So the electronic charts were then audited after the committee met, And it was found that 48 patients did indeed have documented weight management plans within their electronic record. The second case study was done on type 2 diabetes. It was within the primary care setting as well, and they focused in on this because they noted a gap regarding type 2 diabetes plan of care. The provider collected data from 20 patients with diabetes. They utilized standards of practice and clinical measurement targets within the clinical audit. Data was collected and set points within the patient's management of care were obtained. After implementing improvement plans, a re-audit was performed showing an increase of 12% with utilization of plan of cares. The clinical audit remained an annual measurement utilizing the clinical audit cycle. In conclusion, the clinical audit tool serves as a way to assess set standards to drive improvement. It gives us the opportunity to work together as a team to improve our care towards our patients. It fosters growth within our unit. It gives educational and training opportunities. And it drives quality of care, improving the care that we give our patients. Thank you.